Hello, this is Emily from the Clinical Counseling Program at PUC, and I have a presentation on anxiety and coping with the coronavirus. So, in the past 4 months, how has the coronavirus changed us? And why is it important for us to talk about anxiety? For many families, the hardest thing to handle is the uncertainty surrounding the coronavirus. But there are things that you and your family can do even in the face of this unique crisis, to manage your anxiety and your fears. So what does anxiety look like? Anxiety can come in many forms. Some people may experience behavioral changes, which can be hypervigilance, moodiness or irritability, restlessness, change in appetite. There can also be cognitive changes, lack of concentration, racing thoughts or unwanted thoughts. Anxiety can be a physical or a whole body experience with fatigue or sweating, headaches, or stomach aches. Also common are excessive worry, fear, feeling of impending doom, change in sleep, nausea, palpitations, or trembling. You may have noticed yourself experiencing these or seen your family members experience any combination of these in the past several months. So how can we decrease anxiety? There are many ways to decrease anxiety. The first is to manage our worries. Like everything, balance is key. Some worry is okay and makes you prepared. Too much worry affects your daily life. We need to learn to tolerate uncertainty, meaning that we have to be okay with not having all the answers. Remember to stay calm. When you feel yourself being anxious, stop and pause, take deep breaths, count, and slow your thoughts from racing. Focus on what you're doing right now. Remember that you are in control of what you take into your life. And focus on the things that you can control. Accept that there are some things that you can't change. You can also reduce your anxiety through structure and routine. You may have noticed that both of those things may have changed in the past 4 months as you spend more time in your home. Structure in your routine creates containment. You should plan for what you can and be flexible. Structure should include work and some fun time, and don't forget to exercise, eat healthy, and get proper sleep as part of your routine. Make sure you're socially connected to others. Remember that we have the technology to talk and FaceTime anybody in the world. Turn this crisis as an opportunity. What are some positives or silver linings that you can think of that came about as a result of COVID-19? We have seen environmental changes, a rise in a sense of community, and many people have learned that they are more resilient than they have previously thought. Some people have experienced a centering of priorities, they've clarified their core values, found stronger connections with friends and loved ones, and deeper connectedness to purpose. They found a more grounded global community and an appreciation of life. Here are some tips to protect your mental well-being during COVID-19. Be conscious of how much news and social media you consume. Although it's important to be up to date on all information, too much news and too much social media can ultimately damage your mental well-being. Be sure to engage in self-care. Take care of your body and spirit, and remember to be kind to yourself at this time. Practice good sleep and personal hygiene. Have uplifting conversations and help others. And create your sense of community. Remember to practice gratitude. As we mentioned, what are the positives of COVID-19? So much has changed in the past 4 months. Out of these changes, what is something that you're grateful for? For example, some families may be grateful that they got to spend more time together. Thank you for tuning into this presentation. If you have questions, please feel free to email Dr. Christine Sartiaguda. We would also like to remind you that the Clinical Counseling Department at PUC is offering remote counseling services. If you would like to speak to a counselor, please contact your school's office.